We want to bring in our doctor now. Dr. Edwin Hayes is an infectious disease specialist with Prisma Health, and thank you so much for spending a couple of minutes with us. We know we are facing a dangerous situation with both COVID-19 and the flu spreading throughout our state. So we're going to get to our first question, Dr. Hayes.
Yes, absolutely.
So our viewer says, can you get both the coronavirus and the flu?
Yes, absolutely. You can get both coronavirus and the flu, and we've actually seen this happen in the hospital already. We can test for both of these diseases, and we can confirm that those tests are positive. And having both of these diseases at once is a recipe for disaster. Either of these diseases can be deadly, but the idea of having both at once creates a very complicated medical picture. So you can absolutely get both coronavirus and the flu at the same time.
All right, Dr. Hayes, on that same note, we got this message from a viewer who says, I tested positive in August for the coronavirus. I still have a persistent cough. Is it okay for me to go and get a flu shot?
Yes, absolutely. I would say unless you're having significant illness symptoms, it's reasonable to get a flu shot, and it's definitely recommended for all populations to get a flu shot as soon as possible for the upcoming season. The last thing you want is to have to be battling both of these viruses at once. Most individuals may have some long-term mild symptoms related to coronavirus after having it previously. There can be a slow recovery time, but the actual active disease process is usually about a week to 2 weeks before it resolves in the human host.
This next viewer seems like she has done some research about the flu shot. She wants to know if you can explain what is the new ingredient that's been added to the flu shot this year, why has it been added, and what are the side effects of this new ingredient?
So the flu shot every year is different from the prior year, and it's important to be aware that there are changes in the flu vaccines, but there are also multiple flu vaccines available that will have different ingredients in them. Some of these ingredients are egg-based, and some folks may be a little worried about taking an egg-based vaccine, but there are other non-egg-based vaccines that can be obtained. Sometimes there are also flu vaccines available that do not have mercury, even though there is some hesitation from folks, but no evidence that mercury is an issue. There are alternative flu vaccines that can be gotten, and there's also different strains of flu that are in the flu vaccine. So we actually see changes every year with the actual flu strains that are put into planning out the vaccine. For instance, the trivalent vaccine that we'll be getting this year has 2 flu A strains as well as 1 flu B strain, which are thought to be the ones most notorious for causing disease in the upcoming winter season. The quadrivalent vaccine also has a second flu B strain that's being protected for individuals getting the quadrivalent vaccine. So it's reasonable to be up to date on what kind of ingredients are in the vaccines, but be aware that there are multiple vaccines and they will have different ingredients, and depending on your hesitations or what kind of medical risks you have, you may be able to get a vaccine that is better for you, but I think that's something that it's important for everyone to talk to their doctor about.
All right, thank you so much. Dr. Edwin Hayes is sticking around with us from Prisma. We appreciate you. And if you have questions, you can text the phone number. It's not at the bottom. Oh, there it is. There it's at the bottom of your screen, 803-776-9508. So we know that you have a lot of questions. Thank you to everybody who've written in. We want to check back in with our friend, Dr. Edwin Hayes from Prisma. He's an infectious disease specialist and we want to get right to one of our questions. One viewer wrote in, Dr. Hayes, and said, we took a flu shot in September. How long is this shot good for? Do I already need to get another one?
So if you got it in September for the upcoming flu season, then it should be reasonable for covering you through the flu season. It usually will last for a handful of months. The flu season tends to run until May, classically, although last year we did see it drop off precipitously when people started doing social distancing in March. So we may actually be looking at a shorter flu season this year. It's unclear, but I think the most important thing is getting that first flu shot at the beginning of the season.
So would it be too late to get that flu shot today?
I do not think it's too late to get the flu shot. If the flu shot is available to you and you have not received it yet, I would get it right away.
It sounds like, Dr. Hayes, you're saying it's never too late to get your flu shot.
Never too late to get the flu shot.
Perfect.
That's right.
We've got another viewer who has another question. This viewer wants to know, how will you be able to distinguish the two because the symptoms are similar. So how will you know the difference between COVID-19? And I don't mean doctors. I'm guessing this person means how would I, if I got sick, know whether or not it was COVID-19 or the flu?
That's an excellent question. And the reality is there can be a lot of similarity between these two separate disease processes. COVID-19 can look very similar to the flu with body aches, difficulty breathing, cough. Sometimes you'll see sore throat, pink eye, diarrhea. The flu can do these things as well. One thing that we see more with COVID-19 that we do not see with the flu is the loss of smell or taste. So that might be a more specific finding that makes you suspicious that you're dealing with COVID-19 than with the flu. Another thing that might make you more suspicious of the flu versus COVID-19 is whether or not you had a recent exposure with someone who did have a confirmed case. So if you were recently around someone who was known to have COVID-19 and developed these symptoms of feeling ill, body aches, cough, breathing troubles, fever, you may be more inclined to think that it's COVID-19, while if you were around someone who had confirmed flu, you may be more suspicious of the flu. But both are showing increasing prevalence in the area, and both could readily affect anyone who isn't appropriately protecting themselves. The way we distinguish in the hospital is we have genetic testing that we do with swabs and samples that we take from patients that can confirm both the flu and coronavirus. Sometimes one is positive, sometimes both are positive.
Wow. All right, Dr. Hayes, you just touched on exposure. So we got another question from a viewer that says, if you think you might have been exposed to the virus, how long does it take to get that positive test back? And this becomes very important when we talk about visiting our loved ones over Thanksgiving.
Yes, absolutely. Very, very good question. And it can be a little bit frustrating sorting out the answer when you're planning out things in the future. Typically, the incubation period that we see is around 5 days. You could potentially see someone have an incubation period where they have been exposed to the virus and the virus has made a home inside of them silently before it's actually started symptoms, from anywhere between 2 to 14 days. The actual positivity of the test may not come until about 4 or 5 days after the initial exposure you had. Even with people who have been exposed and are actively sick, the test itself can miss cases at least 30% of the time. And if you have a high suspicion for exposure, sometimes it's worth getting a second test and continuing isolation even if the initial test was negative. But I would say it's probably a good idea, if you think there was an exposure, to get tested at least 4 to 5 days after that initial exposure. You could get it earlier and potentially have a positive result, but you may be more inclined to get a positive result if you give it a few more days. But be aware that the test is not perfect, and sometimes it can miss the infection even if you have it.
All right, Dr. Hayes, thank you so much. All right, 5:32 now. We are on your side getting your coronavirus and flu questions answered. We have invited our friend Dr. Edwin Hayes here, and he is answering our questions. Here's the next one we've got for you, Dr. Hayes. What do you say to people who still say COVID is a hoax? My sister-in-law is a denier.
Yeah, it's very difficult, I think, for a lot of people, especially as we're nearing the holidays. One of the issues with COVID-19, with a lot of these viruses, is that they prey on some of the things that make the best of us, and that can really lead to some of the things that make the worst of us. Our intimacy, our time with family, our time with community. It can be hard to accept the reality that something like this can spread from us to people we care about. I think that it's extremely important that people realize that the situation we're in is really us as humanity versus the virus, and it's not really about us being against each other. I think there is common ground that we can find for how to mitigate these issues, but this is absolutely a virus that I've personally confirmed in many people. I've seen them get sick, and I've seen many people die from this disease over many months now. And as we speak, the numbers that we're seeing in the hospital are increasing, and there's reasonable thought that they will continue to increase over the next few months. I think that it's reasonable for all of us to open up dialogue with folks who are skeptical, but I would reaffirm that personally, as a doctor who works with folks both in the labs and with folks in the hospital to figure out why these people are getting sick and what we can do about it, that COVID-19 is a real virus and it's causing a lot of damage for a lot of people. And there are fundamental things we can do to prevent it. So hand washing, wearing masks, spending time apart from other people at least 6 feet are all fundamental, easy, cheap things we can do to protect ourselves and others. And people should establish boundaries for what they think is reasonable and healthy with other folks and their expectations for how to keep themselves safe. Even if they can't necessarily convince other folks, those folks should respect their boundaries for their own personal health and safety.
That's a great answer. Here's our next question from a viewer. What if every time I got a flu shot, I got sick, which is why it appears this person is saying every time I got a flu shot, I got sick, which is why I don't get a flu shot. Yeah.
Yes, and that's something that, comes up sometimes. People are worried that the flu shot itself is making them sick. Occasionally, people can have some mild symptoms from getting a vaccine, including the flu shot, where they might have some pain at the site or they may feel somewhat unwell for a day or two. It's very rare to have severe symptoms from the flu shot. Now, the shot itself, the majority of shots that we give, and again, I said there are many different flu vaccines, the major flu vaccines that we give are inactivated virus. It does not have the potential to turn into an active infection. And the severe disease that you can get from an active flu infection can be far worse than some of the mild symptoms you may get from getting a flu shot. Unless you've had particularly severe disease in the past from a flu vaccine that required you to spend time in the hospital, I still would urge you to get the flu shot because the issues that you have with that are potentially much smaller than the issues you could have from getting to the flu. Not to mention having to deal with the concern and the anxiety while you're sick of not knowing whether you have the flu or COVID-19. It just simplifies what's already going to be a very complicated winter season.
Dr. Hayes, thank you. We know your time is so valuable. We appreciate everything you've done at the hospital, saving people, and we appreciate you giving us your time today.
Thank you for having me.